The Fellowship of the Great Physician welcomes you to House Call. Our hosts today are doctors of chiropractic, Dr. Gerald Lala and Dr. Richard Jensen, who is also a board-certified acupuncturist, practice independently in North Oaks, Minnesota. Let's join our hosts for today's program that will assist you in your quest for optimum health and well-being.
Hi, I'm Dr. Gerald Lala, and this is Thomas Benarott. Thomas is a personal injury attorney, and we're doing part 2 of automobile collisions, risks you face if you are in an automobile collision. And so we're going to do a little bit more technical information today, and if you didn't see session 1, we'd invite you to do that, and I know that you can go out on our website and you can view the programs out there. Mr. Benarott and I have done 2 other programs on whiplash, and if you are concerned about that you might be malpracticed by a medical doctor, chiropractor, dentist, a physical therapist, whatever it is, there's a wonderful program out there on malpractice also that is very clear about rights and on injuries. And so if you missed session 1 of this, we'd invite you to go out on the website and do that, or you can contact our office. We'll be happy to send you a DVD without any charge, and I'm sure, could I have the liberty of saying that your office would do that as well if people wanted a DVD of these programs?
Absolutely.
Good. Well, risks of long-term symptoms of late whiplash. Can you tell us about that? We know some people have acute injuries. Symptoms occur quite suddenly, or maybe a few days or a few weeks later, but there are other aspects of that as well?
Absolutely. And I mean, even the one concern all people seem to have when they get in a collision is how it's going to affect them long term. Those are the people that kind of feel it early on, but there are those delayed effects too. Sometimes maybe even just because people are, we'll say, ignorant for lack of a better word, but they don't really understand what caused the issue. They have their collision, but they don't link the two right away. And by the time they figure it out, it's what we talked about in the first segment of this show, where the sooner you can identify the problem, the better you are going to be able to fix it, because the longer it goes without being repaired, the harder it's going to be to do it.
And I think that there are, we've been in practice long enough to have a pretty good idea of reading people and personalities and things like that. And there are just an awful lot of nice people in the world that are not litigious in nature. They don't want to bother anybody. They think if they bother their insurance company, they're going to have problems, and they don't want that, and they're afraid to call an attorney when, in fact, Minnesota no fault allows you to very easily call an attorney and get experience or advice over the telephone. I know that you offer that service, and then you see some ads by chiropractors or medical clinics and some law firms, if I could say that, usually around Oprah's time, or around the early morning shows, encouraging you to come in and we'll get your money for you. We'll protect your rights. And certainly they're legitimate ads, but sometimes we kind of go back a little bit and say, I don't know if I want to get involved with that attorney or that, but people do need to seek legal advice, don't they?
Yeah, absolutely. And I mean, most people, they almost seem apologetic when they come talk to me. I mean, we offer free advice for a reason, Sometimes it's just simply that, a simple conversation where somebody feels better, because at least then they took the time to find out. I guess it's a service we provide per se, so that people can feel comfortable. Given where we live in Minnesota, most people are generally conservative, and like you said, the last thing they want to do is get involved in a collision and get hurt, number one, but they don't want to go talk to a lawyer or anything, number two, because they have this guilty feeling about it, and it's like they're supposed to feel bad.
Yeah, it's fault, guilt, and shame. I didn't have anything to do with this guy hitting me, but they say, well, you shouldn't have been there. Well, don't I have a right to be there?
Right. The old insurance adage, you're 10% at fault for just being there, which is absolutely false and just as far from the truth as you can be.
Very, very sad. Well, what we're going to do today is we're going to show you some x-rays of people who have been involved in car accidents and things weren't looked at the way they should have been. nor as thoroughly. So the x-ray that they're going to show you now is of a young child, and Mr. Benarat is going to tell you what happened to this little child.
Right. This is an 8-year-old boy who was in a collision, and what you can see on that view, it was a x-ray that was taken from front to back that shows a significant curve in the spine. It's a scoliosis of the spine, which, if caught early and corrected, as we'll see in a little bit, can certainly be fixed, much to the benefit of the child.
I had the opportunity to look at this child's case history because there was some potential litigation aspects going on. And so as I looked at the chiropractor's file, the medical records of this child, they really didn't bring the child in for it because it had been involved in a car accident. Actually, it had been involved in a car accident 3 months before this x-ray was taken. They brought this child to the chiropractor because of constipation.
Which was secondary to the collision.
That's right. So if we look at the x-ray again, if they bring the x-ray back up again, we're going to see how those bowels are impacted. So there's the before film, and if you look at the left, they're showing you there, see all of those marbled areas that they are circling for you with that arrow? That's the bowels being impacted primarily over on the descending colon and the sigmoid colon side, because over on the left is the ascending colon. And that's pretty clear there, but they're showing you where there's some impact going on there. So that when apparently the child's spine was whipped in the car accident, the muscles went and tightened up and pulled the spine way over to the right, compressing on the bowels. And after a few days, all of a sudden, the child wasn't having any bowel movements anymore. So they took him to the medical doctor. Medical doctor says, give him more water, and here's some suppositories. And you know what it's like to take a suppository yourself. If you ever put a suppository or tried to get one in your child's rectum, is another good experience, And you can't blame them,
I've had that experience.
And so the parents had heard about this chiropractor, and is a very, very good chiropractor. And so the chiropractor palpated and examined the child, palpated the curve and said we need to take an x-ray, and the parents, of course, were concerned about the radiation. But if you go into a chiropractor's office that has updated x-ray equipment, I'm not talking about some machine that's pre-Second World War or even post-Vietnam War. I'm talking about adequate, beautiful new equipment. Then the radiation, they're getting more radiation watching television 3 days a week than they are, or 3 hours a day than they are from that x-ray. But then I know you've got the other x-ray because you were involved in that case.
We do, absolutely.
So we're bringing up the after x-ray now.
Which obviously is vastly different than the before.
Straighten it out. Look at those bowels now, nice and clear. A little bit of gas down there, but which is normal. And that child, I know, is growing healthy. But the legal concern is, will that child, as it develops and grows and matures, will it have post-traumatic effects on the spine, the development of the spine, because those bones are awful soft when it's injured like that.
Absolutely.
So again, one shouldn't be too quick to settle these legal matters, particularly in that kind of an age group.
Very, very true, especially with a minor. But
right.
A lot of people are always quick to, they want their money, which I never can blame them for. But you always have to let them know that they need to wait until everything, we know it's better, because once you settle your case, it's settled and you've given up your rights. It's better to wait until the appropriate time, make sure you're in the clear before you do that.
And it's really interesting. I know some attorneys that are medical doctors and some are chiropractors, and I can't understand how they want to settle these cases so quickly. They're not practicing as a chiropractor or medical doctor. They're practicing as legal counsel, as an attorney. And I mean, they just settle those cases, just click. They're just like they're rolling these cases over, And I think, well, how do we know if we settle a case in 3 or 6 months, how do we know what it's going to be like in a year or 2 years, or how about a developing child?
Well, part of that goes back to somebody experienced like yourself too, where I can inquire of you as to what you think long-term effects will be. And obviously none of us can predict the future with certainty, but sometimes clients will dictate what they want. But I mean, the key thing as counsel, I have to caution them and make sure that they understand the consequences when they settle their case in 6 months, especially if they're calling me 2 years from now and things have gone very bad and they need surgery. I can at least remind them that, remember when we had the conversation at 6 months, and do you want me to send you a copy of the letter I sent you then where I told you I didn't think it was a good idea, but you went against my advice and wanted to do it anyway?
Mm-hmm. I had an interview with a person last week, and they had been in a serious automobile collision. I had gone to a chiropractor, and the chiropractor referred them to a neurological center, and MRIs and CT scans were done. There were significant injuries. And then the insurance company quite quickly sent them for an independent medical examination, of which we've talked about on previous shows, and we'd really encourage people to download those off the website or contact your office for them about independent medical exams. And so they're getting bills from the neurological center, they're getting bills from the chiropractor, and they feel under this pressure, and the chiropractor's office is calling them wanting their money, and the neurological center, medical clinic is calling them, pressuring them, so they say, well, I better get this thing settled. Well, isn't it important that they have good legal representation, not just initially, but for some attorney to handle those kind of issues when people are pressuring them?
Absolutely. And I mean, if nothing else, as an attorney that represents injured people, I deal with that every day. People in the general public hopefully don't have numerous collisions throughout their life. They're not supposed to know exactly what to do. That's why they need to seek out advice from somebody that is experienced, that can help walk them through those things, not make them feel like they immediately have to act and maybe settle their case too quick to get a bill collector off their back, when there's a much better way to go about it, especially in the case of the independent medical examiner. Certainly there's remedies available to them, such as no-fault arbitration, that could be done by an individual, but probably more appropriately, just because of what goes into it, should be done or with the assistance of an attorney.
What about this term called runners? I know that I know people watch our program all over the United States and outside of the continental United States, and, but of course we're in Minnesota, and we have a no-fault law here. And I know that there have been issues some years ago with the Minnesota Board of Chiropractic Examiners trying to rein in a little bit about runners. What are runners?
Well, here, I'm probably naive a little bit even as to what they are as far as how they operate. But runners are people that will grab a police report list that kind of shows who was in recent collisions. I don't know exactly how they get that, but they have a service that provides that to them. What these people then do is they go directly to the individual that was in the collision.
And they go to their house, or?
However. Yeah. Follow them.
Apparently your office doesn't use them.
No. And anyway, in any event,
I never have either. I've never met one. That's why I asked you. So.
Yeah, and they try to solicit the business, I guess, to get it to, I suppose, an individual that wants to treat them and make money doing that, and in some cases to a legal office, I'm sure, who wants to represent them and try to, again, procure fees by way of that method.
What do you think, as an attorney, of a doctor who says to somebody who's been involved in an automobile collision, oh, just come on in and see me. I'll take whatever the insurance pays, no problem. Should I have any suspicion of a practitioner like that?
Yeah, I would think you probably should. I mean, what you want is you want the best medical care you can get, which is going to encompass, I guess, not first the forethought of money, but more so the thought of making sure that you identify the problems, figuring out the best way to solve the problems. And by doing that, you can't tell for sure what's going to happen. I just had a client last night that I'd met with that said, give me an idea of what my case is worth and how long this is going to take. And I said, well, I can't. Your collision was just a few days ago, and it's impossible for me to do that. I think it's the same way there. If somebody starts talking to you about money right away, whether it would be the lawyer or the treater, I think that should probably set off a red flag, because they're probably thinking more about money than they are about the right thing, which is trying to help them get better.
I know that frequently our clinic receives letters and telephone calls from companies in the state of Minnesota and around the United States that say that if we pay them a certain amount of money, what they will do is they will try to provide referrals for us of automobile victims, automobile collision victims. And I've never bought into that. Just smells a little fishy to me, but I know that there are chiropractors and medical clinics, I've heard, that have signed up to those agencies. So would they kind of even be runners, or?
No, I don't think that's runners at least not in the sense that I think of them, but certainly it's a method of marketing, which I suppose I could make probably the argument for them and against them, but it's another method of getting patients, and right, wrong, or otherwise, I guess it happens.
I know here A couple of weeks ago, we had somebody call the clinic, and they wanted to come in. They had been in an automobile accident, and our entrance receptionist, who takes a brief history over the phone, anybody else in the car, and said, yes, 8 of us. And what kind of a car was it? A Volkswagen. And she said, 8 of you were in a Volkswagen. Well, was it the kind of bigger Volkswagen? She didn't know the name. And the person said, no, a Beetle. And so she put the person on hold and walked back in my office and said, there's some people here. Would you like 8 new patients that were all seriously injured in a car accident? And I said, oh, wow, how could we ever get 8 new patients in here? We're already busy. And she said, but interestingly, they were all in one car, Volkswagen Beetle, And I said, gee, that's really interesting,
Yeah,
So
that sounds a little fishy.
And they all had the same attorney, too.
That sounds even fishier.
Yeah. So, praise the Lord. Well, we're going to look at some other x-rays now that you and I have looked at together, so we can kind of share about them. And this particular one here is a full spine x-ray of a person, and this person had been involved in an auto collision about 4 years ago. And what you're going to see is the spine. You're going to look at the spine, and at the bottom is going to be the pelvis, and then you're going to see the lumbar spine, and that's going up the lower back. So we're going to start down in the pelvis, and then we're going to go right up the lower back. And see, that's the thoracolumbar junction there where it's curved. They're putting that arrow on there for you. That's very good, isn't it? Aren't these computers wonderful?
They are
just
wonderful.
Work automatically and no humans involved whatsoever, right? So, no, don't take that x-ray away. That's such a pretty x-ray,
I think they were getting back at you.
And so then the spine looks like it straightens out there. But that person now was involved in what was initially a whiplash injury involving the neck and upper back. Had a little bit of pain in the lower back, not much. But after about 2 months, then they began to develop some lower back. And unfortunately, the chiropractor that they were seeing didn't pay attention to lower back because he figured that only the insurance company would pay for the upper back treatments. They denied lower back treatments. And the reason that they denied lower back treatments is that the chiropractor did not have a good, thorough examination of the lower back and thorough radiographs. So this is what very often can happen, is they'll develop serious spinal problems. Do you have anything else to add to that, Tom?
Well, I think it reinforces the point made in the first program, too, that thorough history is obviously vitally important, not only to the well-being and betterment of the patient getting better, but also to the legal case and trying to pursue it. The insurance company, they do their job in essence, trying to parse out what is and isn't related to a collision. And if you don't do a thorough history, not only will it hurt the patient in getting better, but it also hurts their ability to make a recovery of money and or get their bills paid.
This is really funny, and I think it's really funny. You and I know about playing the Jesus card, the God card. When they're in jail or arrested, all of a sudden they've had this trench hole of salvation, And that does happen. We know, and it's legitimate. But this is a doctor, a chiropractor, not around here or anything, who I saw some ads of this doctor. And he talked quite a bit about God, that God wouldn't want anybody to be sick, but still no thoroughness was done. Are you with me? So I remember the first practice management book. There weren't any practice management seminars when I started practice in 1965 for chiropractors, so I took another profession's seminar, and the textbook was titled The Flight Manual to Success.
Gives us a hint maybe what it was, huh?
Success. And then the subtitle was How to Build a $100,000 Practice. This is 1965, which today would be probably a $5 million practice, And the first thing they said, the first impression is in your reception room. We grant that, and people look at our reception rooms. But they said the one book that you have to have in your reception room is a Bible, because that'll make people think that you're a good guy. Therefore, if you're a good guy, or if you're a Christian, you must be a good doctor, which is...
The two don't necessarily go hand in hand.
No, they don't. And I think Jesus tried to deal with some of that, too. All right, let's look at the next slide. This is another scoliosis that is certainly even more significant radiographically than the previous one. What we're looking at here, again, is a very, very serious curve of the lumbar spine and the lower back. And then it puts a great deal of structural stress as it goes up there. into the thoracic spine. And of course, then it shifts all of those ribs and all of those organs. So it would be rather logical that to assume and to accept that this patient began to have menstrual issues.
Right.
Because not only are you adversely, or that curve adversely, there's another one there, another patient with a serious scoliosis. Not only are they going to, if they're females, be predisposed to menstrual issues, and that's related to the fact that our bladder problems, recurring cystitis, because those nerves, arteries, and veins and acupuncture meridians that come out of the spinal cord and pass out from the vertebra, which we're going to look at in maybe this show or another show, are going to adversely cut down the proper nerve and blood supply of those organs. So she's going to start to have problems, just as a man could have genital urinary problems, prostatic problems, see.
Right.
But very often, if there isn't an adequate case history, or if we neglect the systemic functions of that person, we just look at their spine.
Right. Well, again, back to the point made early on in the show, too, why some people don't always make the connection between their auto collision and the problem they're having now. I think if I'm stating correctly, generally the dermatomes in the body, the nerve endings affect a lot of different things. They affect your brain and the serotonin that's put off. They also affect a number of things, such as here, if things are restricted, stops peristalsis, causes constipation and other things like that.
Or diarrhea.
Like it did in the child.
Yes,
And which doesn't always, even logically to the educated person, necessarily immediately cause them to think about the motor vehicle collision, even though there's a direct corollary when you have somebody that does a good enough history and obtains the right information to connect the pieces.
Yeah, and the patient is at a significant disadvantage, because if they don't have a medical background or a medical legal background, they're not going to know if those doctors' records are good or not. They just assume if the doctor's a nice guy or a nice gal, they must be a good doctor, which we know in malpractice, good guy doctors aren't necessarily good doctors.
Absolutely. There's a lot of people that have committed malpractice, a lot of physicians that are nice guys, but just because you're a nice guy doesn't mean you give good care.
Actually, in my experience, I found that the guys and gals that come off with the How to Win Friends and Influence People, big back slappers, great personalities, oh, they're so nice to you, really personalities, are usually the worst doctors when it comes to dispensing science-based care, but the patient doesn't know that. And so then it becomes prudent that an attorney who specializes in motor vehicle collisions or specializes in malpractice, therefore that person knows, or somebody like yourself that was initially trained as an insurance claims reviewer, adjuster, they know about what's a good medical record and what isn't good or adequate medical record. So it's so important then, am I correct, that they would seek legal advice soon and that the attorney would get those doctors' records soon?
Correct.
So that the attorney would have some input into it. Does it look like this chiropractor, this medical doctor, massage therapist, physical therapist, whatever person they're seeking treatment from really looks like they're doing a good job? Because records really do say what I do or don't do, don't they?
The record is the basis for which any jury will make their ultimate decision. If they like the witness, that helps. But in the end, and I found this in malpractice cases, trying malpractice cases, same thing in auto cases. If the witness tells them one thing, they may believe them, but if the record says it, more often than not, they're going to believe what's in the record. And if the record doesn't say it, they're not going to believe it.
There was a recent medical research study conducted, I think it was in early 2007, so it's some time ago, that went and interviewed thousands of patients of medical physicians. And they wanted to know if they felt if they were getting good medical care, adequate medical care, or poor medical care. And the patients responded. And they asked them then, how do you base if it was good, adequate, or poor medical care? Are you aware of this research?
A little bit.
All right. And of course, it was that they felt that they were really getting good medical care if the doctor listened to them.
Bedside manner.
That's right. But when they went and reviewed the doctor's records, they found that the doctors that the patients thought were really getting good medical care were actually getting mediocre medical care. And when I review chiropractic records, and I don't do that for insurance companies, so it's not like I'm getting any money from insurance companies to, have a slanted opinion, which hopefully nobody would give a slanted opinion. But it's interesting how when you look at those medical records, and I, of course, know some of these doctors because I've been around for a while, and they attend risk management seminars. And so very often when I have some guy or gal come on to me that's a big backslapper, and hey, how you doing? They tell me how great they are, and they tell me they're seeing 100 patients a day, and oh, they had 22 new whiplash patients this month, and 14 workers' comp patients, and all of that. And I just say, oh yeah, watch out for this guy. Just like a bragging surgeon, a MASH type surgeon, the old MASH series. You got to be really careful about people who come on, because if I'm a good attorney, I think, or I'm not an attorney, of course, or if I'm a good chiropractic physician, I don't have to brag on myself.
True. Well, that goes back to the theme we've used multiple times. The best referral to somebody, either for an attorney or a treater, is the personal referral, somebody that recommends them, that you can feel comfortable with, and then you can gauge for yourself whether or not you agree.
Mm-hmm. And usually the longer experience is certainly a large factor.
Absolutely.
But again, as an attorney or a physician, a chiropractic physician ages, you assume they have experience, but does it look like their clinic is updated?
Right.
Like I remember I was in your office once, because we have no business relationship with each other, anything like that. And something, I don't think you've ever bought me a meal, have you?
Oh, yes, I have.
Yes, you did. We went to Byerly's. You paid for a chicken sandwich once. So it's a real big deal going on there. But we want to keep it clean, don't we?
Absolutely.
But the thing of it is that we just have integrity, that when I walked in the reception room, it was clean, it was up to date. I mean, it didn't have glass chandeliers hanging from the ceilings and your picture all over the place, and stuff like that, and your kids flying off to Europe to ski in the wintertime and things like that. Not that that's wrong, but it's kind of, I don't need to brag on stuff like that. But again, integrity is a significant thing, and very often, I know one of our daughters went to a dentist who advertises quite heavily. And he's got all these pictures of everything he does and stuff like that, and said, pretty nice looking, real nice looking office. And I said, well, did he make recommendations for treatment? She said, yeah, they wanted to do this and do that. It was about $12,000. And my insurance would take care of some of it, of course. And I said, well, are you going to do it, honey? And she said, no, Dad. She said, I just sensed that this guy was more interested in my insurance than he was really in my mouth. And I'm glad that we've raised our kids to have some kind of discernment, about quality people. So, well, I think we're going to be doing another show, wouldn't you think so?
I think so. We probably got we chatted a little bit more than we thought about a few different topics. But, I mean, I think on the last topic there, if you feel comfortable with somebody and you know that they're looking out for your best interest, that's probably the best feeling you can have, whether it's you or me or whomever they're either represented by as legally and or a chiropractor. But good bedside manner is one thing. Making sure that you're getting better and making the progress you want to is probably the key component, whether you like them or don't like them, in what we're talking about.
I think would you really want your wife to be in that office, or would you really want your child to be under that doctor's care?
Yeah, I think that's probably a key question.
And birds of a feather do flock together, don't they? Arrogant people hang around arrogant people, humble people hang around humble people. Great attorneys associate with great attorneys.
You try.
Well, I know you try, but I really think that's true. So,